everybody, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. I bring on guests all the time on this show. Okay, and today's guest is a very special guest. Her name's Martina. She's been working at one of my clinics, which shall remain nameless, right? We like to keep people anonymous on the show. But we have a lot of viewer questions to get back to you. And we also want to get some of Martina's experiences from being a coordinator. So how long have you been a coordinator for?
About a year and a half now.
Okay. So, and prior to working here, you had zero experience or very little experience?
In clinical research?
Yes.
I have experimental research experience, but as far as clinical research, I didn't have any experience.
Okay, so what were your expectations when you saw the job posting? What were your expectations of the job?
Well, I didn't know what to expect in clinical research. I didn't realize how detailed it is, and there's so many forms and so many things that you have to do and go through. And like in contrast to experimental research, whereas you do lab work, in a lab, it's a wet lab, you dissect mice, you follow like your PI's instructions, and you basically anticipate a publication through that. However, in clinical research, it's a lot different because you actually deal with subjects or patients, people that come in, and you have a lot of hands-on experience in terms of dealing with the patients and dealing with, all the paperwork and everything that is behind that.
Yeah, a lot of viewers actually, they want to get in this industry, either to become coordinators or to become CRAs.
Okay.
And a lot of them have very little experience. So what type of people, in your experience now, after a year and a half, right? Or is it 2 years?
I think it's almost 2 years.
So after almost 2 years, what type, you've done enough studies now and you've done enough clinical research coordinating work to understand what type of individual would do best at this job. And so what type of person would that be?
Well, you have to be passionate about, an advance in medicine, because you just have to be passionate that there is going to be, new things out there that could help people. So you have to, be passionate about helping others. I think that's the first and foremost goal in clinical research. And the second thing is you have to be detail-oriented, because you have to make sure that everything is done. You have to, look at the sources, the source documents. You have to make sure that everything is completed. You have to make sure, you basically have to make sure that your whole list of things to do is completed as well. That's very important. And you have to be able to deal with people, and you have to make sure that, in a professional setting, you talk to a person, make sure you know everything, like what you're talking about.
Right.
Make
now
sure
let's talk about dealing with people, because you and I have dealt with a few difficult individuals, specifically monitors.
Yes.
Right? So
Yes.
I did a popular video like a year ago, how to deal with difficult monitors.
Okay.
But that's just my opinion, and people know my opinion. What's your opinion? Because you've actually dealt with this recently and currently dealing with this. And from time to time I get involved, but usually it's you. Like 95% of the time. You're the first line of defense as the study coordinator.
Okay.
So how do you deal with the difficult monitors?
Well, first off, I think that it's very important that you have to be knowledgeable about the protocol. You have to know the protocol back and forth. Make sure you read the protocol once you get it, because you will be tested on it. That is they want to know and make sure that you know what's going on, what kind of medication you're dealing with, what kind of patients fit the study, what patients they need. So that's the most important thing to know. The second thing is you have to use your people skills when it comes to monitors. And you have to let them understand that it's very, you're doing the best that you can to work with them, and let them know that you're both on the same side.
Mm-hmm.
So that's very important.
And which type of monitors give you the... Well, I know the answer to this, but I'm asking you.
Okay.
This is a softball question.
Mm-hmm.
Okay. Which type of monitors give you the hardest time? Like, are they the ones that micromanage, or are they the ones who kind of let you, the coordinator and the PI, use your best judgment?
The ones that micromanage.
Yeah, so
Mm-hmm.
any advice to study coordinators out there currently in your situation dealing with a very difficult monitor and it's upsetting the PI, like it is in this case,
Mm-hmm.
what do you do?
You need to talk to the monitor and explain to them that you're trying the best that you can to, work with them, because you both are trying to, get through all the information,
Mhm.
and you're both on the same side, and just make sure that that everyone understands that, you're doing this for the patients and for the safety of the patients, and that's the number one thing that is important, is that the safety of the patients, that's basically.
So
what's
can you
important.
give me an example of what this difficult monitor,
Mhm.
some instances where you felt she was being unnecessarily difficult and combative?
Yes. Well, not to get into a lot of details, but
Yeah.
one of the things was that my knowledge of a protocol was tested in front of the PI and in front of other study staff members.
Mm-hmm.
And I think that that was to basically embarrass me if I didn't know.
So the entire
protocol.
purpose of that was not to help you understand the protocol better.
Mhm.
It was to throw you under the bus in
Yes.
front of your supervisors.
Yes.
Okay.
That was
that's,
one instance.
That's probably the worst.
Uh-huh.
All right. Well, and tell everyone what you're going to be doing, because you're going to be leaving, but you're going on to better things, right? So let them know you're going to be what?
A doctor.
You're going to med school.
Yes.
And then what did you tell me you wanted to do after med school?
Clinical research.
As a PI, right?
Yes.
So this leads, I set you up for this softball question
Okay.
because it's a perfect segue to my next question from a viewer who shall remain anonymous. Okay, but listen to her question, okay?
Okay.
I'm an in-house CRA with 10 years experience managing trials. I've worked for a sponsor, CRO, and have a strong handle of operations. Over the last couple of years, I wanted to take off on my own with the goal of more financial and personal freedom. I'd love to start an SMO. The problem is that I make $130,000 a year.
Okay.
And I truly enjoy the comfort and benefits that come with a salaried position. And I ask you this because you actually you're an entrepreneur too, I think, right? And you want to eventually start your own clinic when you get licensed as an MD.
Mhm.
So it's actually a good question for you. So will I be able to comfortably make a similar wage as an owner of an SMO once I account benefits and all? And most important, how do I transition from this comfortable position to my SMO without losing too much money in the transition? This seems to be the hardest and scariest part. I've listened to your talk on bootstrapping, so then she gets into some of my other blog posts. So give us your take on that, and then maybe I'll give my 2 cents on this.
Mhm. Well, the most important thing is to weigh the pros and cons for the situation, because if she feels that she will be losing more than benefiting in the situation, then maybe she should rethink, why does she want to open an SMO if she'll be losing. So the first thing is to address what kind of goals she has, and the second thing would be to weigh the pros and cons of whether or not this will benefit her in the long run.
Yeah. So my take is similar to that. Like any entrepreneurial venture, there will be some risk involved. There's actually a lot of risk involved, and it's very difficult to leave a comfortable position. And I can't remember who said it, but somebody famous said, the enemy of entrepreneurs, or the enemy of greatness, is good enough. So this applies here because you're making a good enough salary to possibly be an obstacle to get in the way of you making a great living for yourself. And there probably will be some sacrifice. There's another quote similar to that one. It says something like, an entrepreneur works what other people are unwilling to work for a short time in order to live the life that most people can never live.
Mm-hmm.
So again, this related to that as well. My suggestion would be, if it's not in your DNA and you're not an entrepreneur, I would say don't do this. I don't know this person in particular. We have a teleconference set up for later to see if my company can provide her any services to help her. But if you are not hardwired to be an entrepreneur and a business person, I don't think you're going to be very successful. Now, if you are, you're going to find a way to make it happen. I know some people, this is a fact, I know some people I've partnered with that were CRAs.
Mm-hmm.
They may not have been making as much as this person is, but they were making close, like 70 or 80,000. And they were willing to, for the first 2 or 3 months, work both, continue their job, and at the same time build their own clinic. And I know you want to build a SMO, that's a very ambitious goal. You should start with one clinic, because that's how the SMO starts. You want to build the foundation, start with one clinic, and then open another one when that one gets profitable. But the point is, this person found a way to make it happen, and she's now in the 6th month of the company and starting to turn a profit. And she has quit her other job as a CRA 3 months ago. So, and she's still not making as much as she was then, but she will. She's partnered with us, and we're giving her studies, and she's going to be making a lot more than what she was making.
So there are sacrifices, but...
There's sacrifices, yeah. And I don't know if this person has a family or anything, because the person that I partner with didn't. She's not married, so I don't know your particular situation. But at the end of the day, if you're hardwired to be a business person, you're going to find a way to make it happen. If not, hey, the enemy of greatness is good enough. Sounds like your salary is good enough.
Yes.
That could be a dangerous thing, right?
Yes.
Anything else you want to talk about?
No.
Anything about central IRBs? I had a question from someone. He's asking, you understand this enough, right? About central IRBs?
Mm-hmm.
So he's asking, this is a guy who wants to open a clinic,
Okay.
another guy. And he's asking about central IRBs and when you're allowed to use them, and do you have to pay them yourself, or does the sponsor provide the central IRB for you to use? So the sponsor provides it for you.
Yeah, a lot of the time the sponsor does.
And
Most
from
of the time.
from the studies you've done, yeah, if they're a university, they have to use local IRB.
Yes.
So from the studies you've done with us here,
Mm-hmm.
they've all been central.
All
right?
of them.
And how difficult are they to work with, the IRBs?
They're not difficult at all. They're very helpful. If you have any questions, you just give them a call.
Mm-hmm.
Everything is electronic. All the forms are electronic. You submit all the forms electronically. So it's really simple.
All right. Anything else?
Not at this time.
Any recommendations you have for future coordinators?
Recommendations would be...
Don't work for Dan?
No, I wouldn't say that.
Okay. Very good answer, Martina.
Just understand what you're getting yourself into.
And what about follow-up?
Follow
Right.
up with questions. Just follow up with your work. Make sure everything is completed.
Follow up with your combative monitor.
Yes.
All right. Thank you, Martina.
You're welcome.
This is Dan and Martina signing off from theclinicaltrialsguru.com. Thank you.